Assalamu alaikum and welcome to today's Health is Wealth. Today we'll be talking about cardiovascular disease. There are an estimated 7 million people in the UK who suffer with cardiovascular disease. I'd like to welcome Dr. Aseem Malhotra, who is a consultant cardiologist and an expert in cardiovascular disease. Welcome to the show, Dr. Aseem.
Hello, Nadia.
Dr. Aseem, do you mind telling us what is cardiovascular disease?
Well, cardiovascular disease are diseases that affect the heart and the circulatory system. We know that globally it's the number one cause of death worldwide, contributing to 20 million deaths per year currently, and this is estimated to increase by 2030 to around 23.3 million.
So that's quite a high number.
Yes, it's a very high number, and in fact about a quarter of these deaths occur prematurely, so under the age of 65, and about 80% of these deaths also occur in low and middle income countries, so they are disproportionately affected as well. What's interesting to note, however, is about 80% of cardiovascular disease is lifestyle related. So unhealthy diet, smoking, lack of activity, alcohol misuse all contribute. In fact, diet is probably the single most important factor in driving heart disease, probably contributing to 40 to 50% of all heart disease. And there are four major risk factors to develop heart disease. Those are type 2 diabetes, high blood pressure, smoking, and also abnormal cholesterol, or what we call dyslipidemia.
So what contributes to high cholesterol?
Well, it's actually diet specifically, but a lot of it's genetic. But more than high cholesterol, it's specifically the types of cholesterol particles in the blood. So we have something called HDL, which is known as a good cholesterol, and that should be high, and that can be raised by diet, which I can talk about. And also high triglycerides are actually also a risk factor. And then you have LDL cholesterol as well. But when you look at heart disease, actually the biggest factor probably driving risk of heart attack is insulin resistance. So these are all amenable to doing regular exercise, but more specifically, the biggest impact is going to be through dietary changes. And what many people don't realize, even people who've suffered a heart attack, adopting what we call a high-fat Mediterranean diet is actually much more powerful a tool than all the medications we can give you combined in reducing your risk of death within a few years.
So we've talked about diet quite a bit. But what about exercise? I mean, how much of a role does exercise have? Yeah. And my sort of leading question from that would be, you know, our viewers at home, our sort of elderly generation who are, 65 and above, how can they engage in physical activity?
Well, I think any kind of physical activity is going to be beneficial. Do what you enjoy, whether it's dancing or cycling or a brisk walk with your wife, family member, with a friend. Try and go for a brisk walk, especially the elderly people. Try and go for a walk every day. Do it after dinner, do it in the morning. Even a 20-minute walk will do wonders to your health and can significantly reduce your risk of developing heart disease.
So I've heard somewhere, and you can correct me if I'm wrong, that walking is better than running. Is that true?
Well, actually, it's interesting you say that. So when people look at studies looking at ex-Olympic athletes, the people that do the elite athletes, for example, the elite athletes, they don't live any longer than golfers or cricketers.
Really?
So really any kind of activity is going to be beneficial. You don't have to necessarily tremendously strain your body. Do something you enjoy, something you feel comfortable with. But certainly walking has many health benefits. One of the issues of running over a long period of time is it can actually, in many cases potentially damage your joints and your knees. So just get active, get moving. Try not to sit down for very long periods of time. And in fact, that's going to have a tremendous impact on your health. But combine it with a healthy diet.
Yes.
It's very important.
So we've talked about diet, we've talked about exercise. Now, when we talked about diet just a few moments ago, you mentioned cholesterol. So would you mind sort of telling us what kind of foods are quite high in cholesterol? Should we completely be avoiding these kind of foods?
Well, the first thing to say is it's now been proven that high cholesterol in food is not harmful to you. So foods that are high in cholesterol, such as eggs, are not harmful, they do not affect blood cholesterol very much, and in fact are very beneficial. So eating the egg with the yolk in particular, which is high in vitamin D and has lots of essential amino acids or protein, is very healthy. In fact, I'll be honest, I follow my own advice and I probably eat 10 to 15 eggs per week. Because I know
per week?
Yeah, absolutely, because
really?
of great nutritional value. The foods I would say that you should avoid that increase what we call inflammation in the blood which links to increasing the risk of heart attack, are really foods that contain high in sugar, high in refined carbohydrates. The foods to eat a lot of are lots of vegetables, olive oil, nuts, and there's nothing wrong with if you want to cook in butter, there's nothing wrong with a little bit of butter. I wouldn't say gorge in it, but having ghee and butter, for example, and cooking in that is reasonably stable at high temperatures and is not proven to be particularly harmful. But certainly having things like olive oil and nuts in your diet is probably going to have the most beneficial effect. The other thing I would add as well, if you're a smoker, very harmful. In fact,
I was actually going to come on to that, so it's a good job you
mentioned
that.
So smoking, actually stopping smoking will have a massive impact in reducing the risk of heart attack within a very short space of time, because even 30 minutes of passive smoking increases what we call the clotability of blood, platelet reactivity, and that increases the chances of forming clots in the blood, which is what causes heart attacks. So stopping smoking is a very powerful tool to reduce the risk of heart attack, even if you do it in middle age. So that's something that, your people watching, families, people who smoke, they should take that on board, that smoking is extremely harmful when it comes to having a heart attack. And if you're a smoker and you have a heart attack, you're 50% more likely to die.
That's a high statistic. That's a very high statistic. So that's great. So we've talked about preventative measures for cardiovascular disease. What if you are currently suffering with cardiovascular disease?
Well,
what sort of advice do you have for our viewers?
Absolutely. Very good question. Very important. So the first thing is make sure you're taking the prescribed medications that your doctor's given you. In particular, the two most important medications for people with heart disease to reduce the risk of a heart attack and death in the long term are aspirin, or another blood thinner called clopidogrel, which is also prescribed, and a statin drug, cholesterol-lowering drug.
Do you mind sort of expanding on what a statin actually is?
Well, the statin is a drug that's been around for a long time. We know that in people with established heart disease, that it actually reduces the risk of heart attack and death. It works by lowering cholesterol in the blood, but we believe actually the effects of statins are independent of cholesterol. So there's some other effect it has in reducing inflammation, and that's probably where most of the benefit comes for heart disease. Interestingly, people who are at low risk of heart disease don't have any what we call mortality benefit. If you're a low risk of heart disease, you may have a few risk factors, then actually taking a statin will not prolong your life by 1 day. And there are also concerns about sometimes side effects outweighing the benefits. But in people with established heart disease, certainly it has a very good benefit. And aspirin obviously is another drug that thins the blood.
Any other sort of precautionary measures that cardiovascular disease sufferers should be taking, apart from obviously adhering to their medication, taking their medicines on time?
Yeah, I think really adopting lifestyle changes. One is not a substitute for the other. So if you're taking these medications, also realize that making lifestyle changes, whether it's stopping smoking, eating a healthy diet, or doing more regular activity, is actually going to complement your medications. In fact, is actually more powerful than medications at reducing your further risk of heart problems.
Thank you very much for joining us today, Dr. Aseem.
Thank you.
So we've heard today there's plenty we can do to reduce our risk of developing cardiovascular disease and protecting our heart. Having a healthy diet, in particular a Mediterranean diet, has proved to be quite beneficial, and also keeping healthy and fit, but in particular reducing or stopping smoking completely. We hope you enjoyed the show today. Now it's time for our fitness segment with our personal trainer. Assalamu alaikum.
Assalamu alaikum wa rahmatullahi wa barakatuh. Ramadan is a great time to start reflecting on your life. It's a great time to start looking inwards rather than outwards. Now, a lot of people struggle doing this because there's a lot of things outside like stress, your work, your family, your mobile phone, your laptop, everything that steals your attention all the time. Now, if you're one of those people who struggle to find a little bit of headspace, I suggest you try and take up a little bit of meditation. Now, don't worry, you don't have to get into the traditional meditation pose with your legs crossed on the floor or anything like that. You can do it just sitting for 5 minutes on a chair as I'm doing now. Now, what I'd suggest you do is turn off every electronic equipment around you. Shut the door if there are people in the house and really close yourself off as much as possible. You put one hand on your chest and one on your stomach. I suggest you close your eyes, but for now I'm not going to. You're going to take a deep breath, as deep as possible, in through your nose. Inhale deeply. Try and make that inhalation go to your stomach rather than your chest. So the reason why I got our hands here is so that you can feel exactly where that breath is going. And exhale as deep as well as possible. Everything out. Do that a couple of times, and what you'll notice is that your heart rate will slow down and you're going to start relaxing much quicker. Now enjoy that for 5 minutes and do that even perhaps before you go to sleep for a better night's sleep.